steps. What do you think about the technology that you've seen so far?
I mean, huge. Like, first, just to comment on what you were saying, like Usko, the name of the company, I'm originally from Finland. It means trust. So the number one thing that we want to do is make sure that patients can trust us, because
we really like to partnership with places like this that we really do feel, we know that you focus on patients. Just being able to work with you, you already implement things that I've never seen implemented on a company before.
Thanks. Yeah.
Like
our goal is to try to make it easier to book a dental appointment abroad than you would do one at your local dentist. So I'd say we're not quite there yet, but we really want to take the pain and friction out of the process.
And just making people smile.
Yeah.
You know, some patients don't understand. Some people don't understand the beauty of smiling.
Right.
Because they never smiled before.
Totally.
So,
I go to my dentist in Miami Beach, and I look at it very differently now after I've seen the quality and the level you can find abroad. It's a no-brainer. I mean, it's very impressive.
It was all a dream. I used to read Word Up magazine. Salt and pepper and heavy D up in the limousine.
Hello, welcome back to Supreme Dental Podcast Studio. You can be anywhere else in the world right now, but you're here with us, and we appreciate that. Don't forget to like and subscribe. Remember, this podcast was meant for you, our patients. My wife and I are the owners of Supreme Dental Clinic. Listen, we're an Apple Podcast and we're on Spotify. So any questions you got, you know where to send them. Now, today we have someone here that is very special, Mr. Juha. How you doing?
I'm great.
Am I pronouncing it right?
You pronounce it perfect. Yeah, Juha, you got it.
And you are the owner, CEO?
Yes.
Of Usko.
Correct.
Did I pronounce that one right?
You pronounced that one perfect too.
That's 2 for 2.
Yeah, you're killing it today.
Woo.
Yeah.
Tell me a little bit, what is Usko?
Yeah, so really the reason for Usko existing is we want to connect people with really high quality dental providers around the world. So just like you know very well, dental care in the US and in Canada it's so expensive that it's become inaccessible for a lot of people. I've seen some studies where 9 out of 10 people are putting off dental work because of the cost, which is crazy. Dental insurance isn't really even insurance. Mostly it's a reimbursement plan, and there's a lot of work people can't afford to do. And I think you guys have built an incredible business and community and family around helping people from the States get the dental work they need. And the reason we started is we realized there's a lot of people out there who don't know this exists, and we want to be a place where people can come to and get connected with high quality providers like Supreme Dental.
How long have you guys been around?
So we've been doing this for about a year now, and really we started small. We started looking at this as initially a problem that I had friends come to me about. They were like, look, I don't know how to find this.
That's how it starts.
I live in Miami, where it's a very international city. So a lot of folks, the way that they would find a dental or health provider abroad was they had a friend. You know, they had a friend from Colombia, or they had a friend from Mexico, or
word
they
of mouth.
they had a neighbor, and that's how they would find stuff. And we kind of want to be that friend or that neighbor for you if you live in Kansas or Minnesota, you know, or if you're in a city where you don't have people who have gone to do this before. Because honestly, financially it makes so much sense, but what I'm really realizing visiting places like Supreme is the quality of care is excellent. You're getting better care in a lot of cases, and saving on an all-on-4 treatment enough to buy a used car, which is incredible, right? So it really seems like a no-brainer, and our goal is to try to make it easier to book a dental appointment abroad than you would do one at your local dentist. So I'd say we're not quite there yet, but we really want to take the pain and friction out of the process.
How did you hear about Supreme? Because you contacted us in the beginning.
I did.
Talk to me a little bit about that.
Well, I think as a fellow business owner, I can tell you've done an amazing job, you and your wife, with what you guys have built here and your team. And it didn't take long for me as I entered the industry to hear about Supreme. You guys have an amazing reputation. And the reason I reached out is, like, I feel our biggest job is vetting and validating clinics. So we want to work with the best. And part of that is figuring out who are the best, and your guys' name came up very quickly. And well, you're actually the first clinic we're working with in Mexico. We started originally working in Colombia. We also work in Costa Rica and Turkey, and we wanted to add Mexico, but the worry we had was the quality. We wanted to find a place that had really high quality, cared about the patients, did an amazing job, and we reached out for that reason. We knew that Supreme checks all of those boxes.
Take me back a little bit to sorry, when we actually did a Zoom call for the first time, and Luis Olivas, he represents us with your company, and he told me all about you guys, and he was all vetted into you guys. Oh yeah, this guy's amazing. This company's amazing, and I don't just work with anybody, because to me it's all about transparency, and I don't want just somebody who says, oh yeah, we had problems with other places that we decided to leave for the same reasons, because they would just send us patients, and the patients would get here and they wouldn't know half of the things that they were told were a lie.
Incredible. Yeah. Yeah.
They were like, and now these patients had either sold their car or had already spent hundreds of dollars to fly here. And more than anything, you gave them hope on something that didn't even exist.
Yeah.
So then we started seeing all these cases and patients that were here on a reception crying because what they were told was completely wrong.
Yeah. Yeah.
And I said, well, you never sent us x-rays. Well, they said we didn't need it.
Yeah.
Whoa, that's a red flag.
Yeah. Yeah.
And and they told me that this and that, and it could not change. Well, it could go either way. It could change for the better. It could change for a little bit more, but it's because you need it.
Yeah.
And we'll show you here you seen our digital, our computers that are, they're touchscreen, and we show them their digital extras right then and there. All that technology is to show the patient, hey, this is why you need it. You could see it.
Yeah.
It's not like back in the day with those little films. Hey,
Yeah.
you see this right here, and people would say, "Yeah, there's no way.
Yeah.
You ain't seeing anything."
You need a PhD to read that
Yeah,
stuff.
the dentist has to put it at an angle to be able to see it, and they had a little light, and they would see it right there. So we did this differently. So now we tap a button, and we see where the blood flows through.
Yeah.
And all those things. So, and there would be so many hearts broken into my reception.
Yeah.
And we would say, there's no way you flew all the ways down here and you're not going to be able to get this done. So
Right.
we would make it happy for the patient. We would make it happen. But then we decided, you know what, this is not working out, because it's not just about having patients. It's about being transparent, not lying to patients.
Yeah.
Like this upcoming January, it marks our 17 year of us being open.
Congrats. That's amazing.
17 years that if we were built on lies, we would not be here.
Correct.
You know?
Correct. Yeah.
So it's all about the foundation. So then when I spoke to you in Zoom, I was really short, to tell you the truth. I was just like, so what about this? And what about that? And then I told you it's all about transparency.
Yeah.
It's all about, what do you guys do here? What do you guys do there? And then everything just checked.
Yeah.
And I said, okay. And you said, well, I believe once we started working with you, like within a day or two,
Yeah.
like we booked an all-in-4, and then the all-in-4 came on Monday.
Yeah. Yeah. That was great.
And
Yeah.
I was like, okay. And then the patient came in, he was well informed, but I also told you that the way that we would work, because me being skeptical still,
Yeah.
is that if Luis would take over,
Yeah.
and because he knows all about Supreme, and he's one of our agents. We have many agents that work with us.
Luis is amazing. Huge shout out for him. He's awesome.
Yeah, for sure. He's going to be at a podcast with us too.
Yeah. Yeah.
Because he is amazing. And he's very transparent, because things have happened to him
Right.
that if they would have been transparency in play, it wouldn't have happened.
Totally.
So, we're very happy to be working with you guys.
Same.
I think that when you meet somebody that's in the same journey, obviously this is a business and everybody wants to make money, but we want to make it right.
Right.
When we tell a patient, hey, this is what we see you need. Now, when you come to the clinic, we're going to do this, this, and this. We're going to make sure 100% that's exactly what you need. And we want the patient to understand. We want the patient to say, hey, they explained to me everything from A to Z. They gave me my choices. I left and I didn't have crazy pain. Like I had some discomfort if I had some extractions. Actually, we have videos with patients that say, this is me. Like we also recorded a podcast. Hey, I just had my 22 teeth extracted and 12 implants put in. And a day later, I'm at the podcast and look at me.
That's awesome.
You know, and they're like, I'm putting pictures in Instagram and people don't believe me.
Right.
People on Instagram have reached out to us saying, this is fake. There's no way you can do this in this short period of time. I say, well, if you're a dentist and you're telling me that tells me one thing, a couple of things. Number one, you need to go training in other places because there's great dentists and great trainings all over the world, and you need to invest in your technology. Because if you have the right technology, you've seen how it worked. We scan somebody in, we move them we move the computer over here, they design. You've seen all the steps. Hey, how you doing? Thank you so much for being part of Supreme Dental Podcast. We appreciate you guys watching our videos. All the information that we have is meant for you guys. It really is. Thank you so much for those who've been in the podcast and for all those patients that actually pick Supreme Dental. And for the ones that are still out there looking, if you decide not to come with us, we want you to be the most informed so you make the right choice no matter where you go. But if you made it so far on this video, we have something for you. Mention that Supreme Smile. Or better yet, just mention Supreme Smile for your special gift. Now that the holidays are approaching, we want to give just a little something from us to you. So once again, thank you for being here at Supreme Dental Podcast Studio, where smiling starts here. What do you think about the technology that you've seen so far?
I mean, huge. Like, first, just to comment on what you were saying, like Usko, the name of the company, I'm originally from Finland. It means trust. So the number one thing that we want to do is make sure that patients can trust us, because there are so many great providers abroad that can help people, but there's equally as many that are sketchy. And there's also a lot of people in the work of getting people to believe something that's just not true. And I think that's what gets people worried about this. You know, if I was a patient somewhere in the US and had never traveled to Mexico, I'd be worried too. You know, it's a new place. And I think that's where working together, we can really help them feel more secure, you know, and feel more calm about the entire process. Because I can tell you my process today, this is my first time in Yuma, my first time in Los Algodones. I was also a little nervous. I'm like, I've never been here, you know, and Yuma's amazing. I was walking around to dinner yesterday. The drive over is like 10, 15 minutes. The border crossing was so simple, you know, really beautiful, awesome clinic when you get here. But you asked a question about the technology. Incredible. Like, the lab that you guys have built, I think, honestly, there's a lot that you guys have done right. You obviously have a great team. The brand is awesome. You have so many happy patients. But I think it's making that investment in the lab that really separates you guys. I can tell the technology you have from visiting a lot of clinics around the world, it just doesn't exist in-house, you know, and the benefits you get from that is being able to help your patients faster, you know, more accurately, and being able to do it all in-house can save them costs too. So I think it's awesome. It was really, even for me, who's researched you guys a lot, very surprising to see how awesome it is.
I have a picture of you with our shuttle, which is my dad.
Yeah, I know. You didn't tell me that until you told me. I'm like, yeah, he's such a great guy.
And I'll post that picture up here. And it was awesome. You know, it's you actually, when the moment you came in, you said, hey, I can't believe how easy it is.
Yeah.
Like,
totally.
I crossed the border and now I'm here. And we're what, a block away from the border?
Yeah, basically.
And they pretty much, they park right in front of the plazas, which or one of our clinics, it's on either or of the plazas.
Yeah.
And then you've seen how easy it is to get to the hotel.
For sure. Yeah. I just did like 3 video tours for patients who are coming here before the podcast. And the way it started, it was just like, here's the hotel door and like, let's take 10 steps. And now you're in the clinic. So it couldn't be easier in terms of somebody coming down.
And the cool thing is I don't know if you noticed the pharmacies outside the plaza.
Yeah.
Those are also family owned.
Yeah.
So it's like a one-stop shop. Mm-hmm. You stay at the hotel, and then there's the restaurant over here, and it has included breakfast already.
Yeah.
And then you have the pharmacy when you need medication, and then there's the clinic. Mm-hmm. You could even do your hair or your nails while you're here.
Totally.
So it's like,
it's awesome.
You know, you get here. Normally in the United States, you would go somewhere to get your dental work done, mm-hmm. and if you need an implantologist, you have to go somewhere else.
Yeah.
If you need a root canal, you need to go somewhere else. And then it takes weeks. Sometimes it takes months. It just depends on what you're getting done. And here, it's all in-house.
Yeah.
So we get you in. The anesthesiologist, we bring them out. We bring them from somewhere else, from Mexicali, but we pretty much schedule them, and they'll be here within 2 hours. So we built this for the patients itself. Somebody told me once, you cannot be as good as a clinic in the United States. You need to be better. And there's great clinics that I've been to in the United States.
Yeah.
But our technology has to be up to par. When we went to Dubai in February.
Yeah.
Everybody was around the CareStream 9600. Mm-hmm. Everybody was like, wow, which I still have to show you.
Yeah.
And we'll put it here, a video where there's Manny, our receptionist. We took a CAT scan, and there's the face scan. So there's this face, and then there's this bone, and then you put them together, and you're able to see. So you see exactly on the lab, you were able to see how we have the patient's face, and then the teeth, mm-hmm. and then how the symmetry.
Yeah. That was so cool.
How there's a symmetry. So a lot of times you see someone and you're like, oh, those are fake. Mm-hmm. Because they're big.
Yeah.
Maybe that patient had a big mouth.
Right.
But they have a small face.
Yeah.
Which is kind of weird, but it happens.
Yeah.
So now they got this big old teeth. and a small face, and you're just like, it looks weird. And then you see those patients that you're just like, wow, that just looks natural. I love your smile. Where did you get your veneers done? They don't even know it's an all-on-4 and all-on-6.
Yeah.
And that is because of this technology and these trainings that we made it be able to fit your face perfectly and give you a natural aspect of it.
Totally. Yeah, it's really impressive. And you touched on something where it's like, yeah, you almost need to be better than a U.S. clinic so that people really feel like they can trust it, which you guys have definitely accomplished. I go to my dentist in Miami Beach, and I look at it very differently now after I've seen the quality and the level you can find abroad. It's a no-brainer. I mean, it's very impressive.
And also with that comes we have 10 international accreditations. So 10 international accreditations, that's more than any other clinic in Mexico's history. And we do it so patients can feel safe.
Yeah.
Well, what's ADA? Obviously ADA, a lot of clinics have it, but what about AACD, American Academy of Cosmetic Dentistry, and ITI, and there's so many different ones, and you're just like, and then you go to your dentist in the United States, and you look, and they only have two.
Exactly. Yeah.
Whoa, and you see them still using the little putty.
Yeah.
To do the impressions.
Yeah.
And then you're like, I just seen this Instagram, and these guys were digital doing this, and then you see the pig dental.
Right. Yeah.
And then you're like, what is that? And these are not from Mexico.
Yeah.
None of the technology that we have really is from Mexico. It comes from either Spain, it comes from Italy, it comes from Switzerland.
Yeah.
Austria. Our milling machines are from Austria.
Yeah.
So I just need to go to those places. Yeah, I'm here all the time. So
yeah.
So I'm gonna get to go to all those places. George has been to Singapore and Tokyo this year. So
it's awesome.
Yeah, having fun over there, and everybody else here is working. But so tell me, I did not Usko meant trust.
Yep.
And that was one of the questions that I had. Why Usko? I said maybe his kid's name.
Yeah.
But that's awesome.
Yeah, that's the story behind it, because I think the biggest reason people don't do this, I mean, financially it makes all the sense in the world.
Right.
I also love the fact that you get to travel somewhere new, you learn a different culture. Obviously you're going for dental work, so it's not truly a vacation, but you're getting a vacation aspect out of it too. So I think the thing that lacks is like trust. Is this quality going to be what I expect it to be? Is this as good or better than I would find in the States? And I think with you guys at Supreme, you check that off. So I don't see why everybody wouldn't do this. It just makes so much sense.
That brings me to one of the things also is it's very important to us that when they speak about Supreme, we talk about the quality, not just the price.
Yeah.
Because price-wise, we're going to be cheaper than any place in the United States.
Totally. Yes.
But we don't compete with other clinics and other places in Mexico. I want to be measured in quality.
Correct. Yeah.
Because patients don't just, I want to pay a lot. If somebody's going to sell you a Ferrari and it's $250,000 and they sell you one for $15,000, you're just like, what's going on?
Yeah. It's a Pontiac Fiero.
Yeah. What is going exactly? So it's very, very important that it's quality. We focus on quality. We show our patients why Supreme.
Right.
We show our patients, this is what you're getting. This is your warranty. This is the trainings. This is the technology. We have you spoke to Dr. Luis today. He went to Harvard University.
Totally. Yeah.
You spoke to Dr. Elias. He just came back from Brazil. With the top dentist in the world, not a Brazilian dentist only. Like you're talking about Dan Holzclaw was there.
Yeah.
You're talking about and he's one of the top dentists in the United States in the world, So these guys, the books that they would read in school and the books that they carry around on pterygoid implants and zygomatic implants, that's who they're doing the training with, the people that wrote those books.
Totally.
So, transparency is number one. And just making people smile.
Yeah.
Some patients don't understand. Some people don't understand the beauty of smiling.
Right.
Because they never smiled before.
Totally.
So... And the people say, why is he mad? Because you don't show your teeth.
Yeah.
Or when you're eating, you like to eat alone.
Right.
Or when you're talking, face mask was like the best thing that happened.
For sure.
For a lot of people.
Yeah.
They're like, let's keep this going, know? And then all of a sudden now you get a patient that you give them a smile for the first time. And they're just like, they don't know how to smile. They're just like, you don't smile like that.
It's life-changing.
And it's life-changing.
It's amazing.
You give them back their confidence. You give them back... You give them back their life.
Totally.
Being able to eat something that they like and not be in pain, why not?
Yeah, and some of the most like emotional stories that I've had. I mean, I love this type of work where, like you said, at the end of the day, it's a business. Like everybody has to make some money to survive, but it's also something where it's making a difference and making a positive difference in the world for people. And the story that I'll always remember when I was talking to a patient, I always like to ask patients, like, why do they want to do this? You know, why is this important for you? And I almost cried on the phone when they started crying and saying, look, I work a remote job and I can't even smile on Zoom. That's how bad it is, you know? And it was just like, wow, it really like hit me to be like, how's this person's interactions in real life? And for them to be able to go out and get their smile fixed, like it changed everything. You know, it's really not just an investment in your health, it's an investment in your life and how you can really enjoy every moment of what you do. So I think it's really, really important. And it's awesome to be part of a job or a career where you can do that, and to see what you guys have built here. You've changed hundreds or thousands of lives, which is really amazing.
It's every day is something different, and you don't just change the patient's life, you change their family life.
Yeah, totally.
Because now you have somebody in your family, your mom, your dad, your brother, your sister, that now they're a lot more confident.
Yeah.
Now they want to smile more. We had we were watching a podcast when you were there, and I told you, oh, this gentleman is the owner of Ghost Pizza, remember?
Yeah.
And he says that he didn't smile. So you can go down his Facebook, which I did, and you were able to pinpoint exactly after he got his work done, because he's just
nice. Yeah, all of a sudden he's free.
And he's in somebody's wedding, and he's like, bro, that's the first time I smiled.
I love it.
And I don't know how long in my life. He goes, and I'm just like, if I'm going to smile in a picture, I'm going to go out with a bang.
Yeah.
So
love to hear stories
you know,
like that.
it's definitely. And I get teary all the time.
Yeah.
I've been doing this for so long, and there's still, it's the emotion, it's the connection that you make with the patient.
Totally.
From day one. You know, they tell you what they've been through. They tell you, you know, there's people that have had accidents. There's patients that were genetically born that way.
Yeah.
There is people that have had cancer. You know, people that have been turned down from clinics in the United States.
Yeah.
That told them, you know, there's nothing we can do. We just got to pull. Or there's nothing we can do. You can't get implants, or whatever it is. Which I tell my team that it's not that it can be done. It's that dentist couldn't do it.
Yeah, exactly. They didn't know how to do it.
Instead of saying, hey, you know what, I can do it, but you should look for someone that can. It's hard for that to come out of some people's mouths, you know?
For sure, yeah.
And we see that here all the time. Patients that come in and say, hey, you know, I was lost and you guys gave me hope. And a lot of patients have watched this podcast.
Yeah.
And said, you know what, you gave me hope, and I came down here and you gave me a smile.
Yeah.
So now what's next for Usko?
Yeah, I mean, I think what we do is, I'm a tech entrepreneur, so really the thing we're trying to do is use technology to make this process easier. So one of the things that you can do on the platform today is you can get multiple quotes. You can understand obviously we do the vetting of the dental clinics, make sure that the partners are strong and are at the level of quality that we expect. And really right now we're just focused on dental implants. That's the area that we launched in, but we'd love to start adding more procedures, you know, dental veneers being something we haven't really worked into yet. And when I look at the future of the company, we can do this for so many more things besides dental, you know, anything for cosmetic surgeries, thinking about things like IVF, regular surgery. I mean, there's so many areas where people are traveling. And actually last time I was in Colombia, I really noticed that there's a couple of dental and health centers there where you have everything you can imagine in one building, you know, and it's just connecting people with the trusted providers is what we want to be known for. And if I think about like a long-term vision, healthcare in the U.S. is not getting cheaper. If anything, every year it gets more expensive. So what I would love to see is, just like people in the past, if you're traveling to Miami, you'd go on Expedia and you'd look at a hotel. What do you do today? You also look at Airbnb and you compare. And you're like, okay, I could do this non-traditional thing and rent someone's room or rent someone's house. We want to be that for healthcare. So if you're going out and you get a crazy quote from your local healthcare provider, what do? Well, go to Usko and check, you know, put that quote in there and see what you could get from a really trusted provider abroad. And we're going to save you a lot of money, and you'll get a great experience doing it too.
Well, there you go. That is awesome. That's how you change people's lives. I don't know what else to tell you. Look, it amazes me how many patients in the United States are toothless.
Yeah.
It amazes me how people think that they're lost, because a patient puts their trust on a dentist And if they don't get a good dentist,
Yeah.
they get shut down, and that's it. A lot of them don't try again.
Yeah.
They're like, for what? I mean, they're already scared of rejection.
Totally. And it's a process. I mean, to go like, you don't know how many patients you guys probably do directly too, but who haven't even been to a dentist recently, and finding a dentist, getting in with one, getting your x-rays done, getting the assessments. People have had such bad experiences. And then add on top of that, this crazy sticker shock where the craziest one I've seen is an all-on-4 from Boca in Florida for $78,000.
Oh, I see one that exceeds $102,000.
Oh my gosh. Yeah. I haven't quite gotten to that level yet, but I'll frame that one when a patient shares it with us, but it's just that sticker shock. I mean, it does take a special kind of patient to even look after that, because you just assume, you're like, this is the person I trust. It's my healthcare professional. This is what they're telling me. This is what I need. I'll never be able to afford that. And I think getting the word out that there's alternatives like this is so important, so that people get the care they need.
What about when patients have gotten judged? Like, oh, well, when you used to do drugs, and you're like, whoa.
Yeah. I
didn't do drugs. Or we get so many patients that get here and they're embarrassed of showing us.
Yeah.
And we're like, there's nothing you could show me that we have not seen.
Right. Yeah.
And you make them feel like, hey, we're gonna get this fixed.
Yeah.
Maybe it could be fast. Maybe it takes a little bit longer of a process, but it's gonna be done right.
Totally. Yeah, that reminds me of a story. We had a patient who she called with her husband, and they had been thinking about this for a long time. And always remember, we asked for photos, and she didn't send them to us. So I followed up. I'm like, what's going on? You really wanted to do this, and she was basically crying because it was such a bad situation and she needed to get it fixed. And then she eventually told me that we usually ask that somebody else takes the photos for you so that they're a little bit sharper, so that it's easier for the clinics to see them. And she was too embarrassed to have her husband take the pictures. Ooh. So she had to go find a friend and get those pictures done. And she sent them only to me, made sure that he wouldn't see them, because it was something she was so self-conscious about, and to be able to fix a situation like that it's awesome, but very sad to think how much pain you're living with, not just from the teeth, but also from having to hide it from the people you love.
We have one of our agents that he spoke to a mother, and the mother reached out to us after she's seen us online, and then she's seen one of our podcasts, and she told him, hey, you know what, my son doesn't come out of his room, and I'm scared of him. He's had some suicide attempts in the past.
Yeah.
And she started crying, and she said, I just want him to be able to smile.
Right. Yeah.
And I remember my agent called me, and he was just like, that was the hardest call I've ever taken.
Yeah.
He goes, and I gave her some information, and then I actually spoke to her son, and her son opened up. He goes, and because a lot of these patients don't just need teeth, they need somebody, they need psychologically somebody to be there with them, and that's what they need, someone to be like, hey, you're going to be okay. We've seen this before. Look at this before. Look at this after. This was not as bad as yours is not as bad as this one. And look, right. And look at this patient smiling, and we were able to help him out, and he was smiling, and his mom was like, I have not seen him smile since. For your mom, I mean, if I get your wife, I get your husband, but your mom,
man, yeah, what a powerful story.
Oh no, it's crazy.
I love that. That's
crazy.
Amazing.
It's crazy, and hopefully we get to do a lot of the stories with you guys.
Yeah,
also.
No, looking forward to it. We've already gotten started well, and it's amazing to be here. And thanks for having me on the podcast. This is so cool, and the way you guys do everything is just top quality. It's a pleasure to work with you guys.
Thank you. We were in Florida, as you know, and I said how. Because you said, hey, let's get together so we could talk. And, we were in a dental convention.
Yeah.
We were at a Pro Arch Summit.
Yeah.
And when I was there, it shocked me because I was sitting there and there was dentists from all over the United States. Mm-hmm. And my wife's like, oh, let's say we're from Mexico. But after being there for 3 hours, I said, there's no way I'm going to say I'm from Mexico.
Yeah.
Because I'm going to get attacked or something, because everybody was so pro-United States.
Yeah.
And I got no problem with that. I'm like, okay, let's go. Let's see what they got. And I remember Bart, his name is Bart, he would go around and he would ask, so if a patient, what's the lowest all-on-4 that you have in your clinic? And then there'd be like 25,000 top and 25,000 bottom. That was $50,000.
Yeah.
And they're like, so what if a patient says I only got 21,000 for top and 21,000 for bottom, so 42? What do we tell them?
Yeah.
And then she'd be like, we tell them to go to Mexico.
Yeah.
And I'm thinking, $42,000.
Yeah, and you're not
and you
going to
tell
help
him to
this
kick
person.
rocks.
Yeah, yeah.
And I was like, and I spoke to him afterwards, the last day.
Yeah.
And he knew we were from Mexico because the gentleman who actually, he knew I was from Mexico, and we actually had a conference and we told him everything we've done.
Mm-hmm.
And he's like, I cannot pinpoint a clinic in the United States that we work with that's done with, including the podcast and the lab and the Eternal Beauty, which is the cosmetic spa, a medi spa, and then the clinic. And then we've been, I don't know if you know this, but we've been mentioned in the New York Times.
Yeah,
the
of
HuffPost,
course.
New York,
yeah,
ABC,
congrats
NBC,
on all
ICI.
that. So cool.
And
yeah.
so he's like, I've never met anybody who's done all those things, and you're in Mexico and you're coming over here.
Yeah.
He's like, hey man, Bart wants to meet you, like the CEO of the company. So after all said and done, I go up to him and I told him, hey man, told him a little bit about us before telling him we're from Mexico. And he's like, wow, man, wow, that's awesome. And then I go, but when you guys said, let's send him to Mexico, I said, and you said, we'll send him to Juarez. That's what he said.
Yeah.
And I'm thinking, no, you sent him to Algodones.
Yeah.
Because that's where we're at. We're in Mexico. And he said, oh, no way, man. And I said, man, the way that you guys were talking out here just made me understand, if you guys were saying this,
Mm-hmm.
and you guys actually were meaning it,
Yeah.
then this is what our patients are telling us is 100% the truth.
Totally. Yep.
And I'm just like, wow, it's, how can you turn somebody away? Because it was just crazy. And actually I asked one of the dentists there also, which I didn't know. So I'm pretty good reading the room.
Yeah.
So we're sitting down and we got some food and blah, blah, blah. And my wife and I are sitting down, and we have some people that I believe they're dentists, and they're just chatting here in the same little table. And then I go, they're like, well, where are you guys from? So I'm wearing a Supreme shirt with a little blazer. We met Tom Brady, and
cool.
And we have pictures with Tom Brady and with
he's a neighbor of ours now in Miami Beach. Yeah, well, I'm not on nearly the same level.
Wow,
but he's
look
moved,
at that.
He has moved into the general area.
Yeah, he's my neighbor. He's like, yeah, I hate when you steal my newspaper. And then Mark Wahlberg, and we had Ray Lewis, some gentleman, Bracamontes from the CIA, and everybody was amazing. But when we were right there, I asked one of they said, where are you from? Oh, I said, I'm from Mexico. And they're like, oh, they had so many questions, right? And I said, can I ask you a question? I said, why is dental, let's say at your clinic, so expensive compared to us, if the brands that we're working with, they weren't even working with Straumann. They were working for somebody way lower.
Yeah.
But I said the same brand.
Yeah.
And I said, and we're using Amangierback, which is our zirconia that we're using. And you guys are more than twice the price. And she said, well, it's because of rent.
Mm-hmm.
And I said, I'm thinking in my head, was rent really that much? And they started talking about all these other, but they never gave me. And I said, how are you guys taking the all-on-fours? She's like, well, we're about getting about 1 or 2 arches a month. And I'm thinking, oh my gosh. And she's like, what about you guys? And I said, well, we're doing anywhere from 40 up to 52 arches a month.
Yeah.
And they look at us like, are you guys crazy? And I said, and I go, how are you guys taking your impressions? He's like, well, the impressions. And I go, well, have you guys heard of the PIC? I said, actually, right now we have the PIC Dental, but there's some called a company named Shining 3D, and they have something similar to the PIC Dental. I don't know if that's precise. And I go, what happens is they do it there. You scan it in, you send it to your lab technician. He designs, he prints out a prototype. You put it on the patient. Everything's good, or you make a quick adjustment, and now you send it to get milled. So you jump 3-4 days of testing, and that's it. And the lab guy got up and left.
Mm-hmm.
And I was like, oh my God, he got pissed.
Yeah.
He's like, they got pissed that this clinic from Mexico was telling them what they're doing is wrong or not as productive.
Yeah. And
I was like, so I'm happy that these places exist like that. But you should have heard it. You would have been like, there's no way. Like, it's from a movie.
Yeah.
And then this guy would ask a question, and I would answer to my wife, and my wife would be like, and then the guy would actually be the correct answer. Mm-hmm. And she's like, you gotta answer.
Yeah.
Until that, we'll send him to Juarez.
Yeah.
Just imagine, my name's Frank Navarro, and we're the owners of Supremedental in Mexico. Just the DJ just stops right there.
Totally.
And I was like, oh man. So very, very excited.
Yeah, we did one of the videos that we have on our Instagram is a patient who went to a clinic abroad and he went back to see his American dentist. He didn't tell him where he got the work done. And he just tells the story of how impressed the American dentist was with the work and was like, where did you go? Like, who is this dentist? Like, I probably know them, in town. And then he's like, no, they're actually not from here. And that video, like between TikTok and Instagram, we have over 1 million views on it.
Wow.
Because people are like, everybody's commenting like, that's exactly what happened to me. Like, I went abroad, the quality is great. Like, why don't more people know about this? Because it's just one of those things that like you maybe the initial draw is the price, but the reason that you're going to come back and refer your friends and have a great experience is the quality, right? And I think that's where you guys are doing it exactly right, investing in all this technology and making it happen. And you talk about the price difference, and I'm sure rent has a little bit to do with it, but part of it also in the States is like just the cost of legal, like there's so much when you're thinking about insurance and all of these things that don't help the patient at all. These are not things that make the patient experience any better, but the dentist is having to pay for crazy insurance policies. They're having to pay for all of these things that just raise the price. So now all of a sudden you add the fact that the cost of living is so much higher in these US cities. Like, I mean, is it a surprise that ends up being 40 to 50K? Like you add all these things, but none of these things help the patient. The quality of the material is what matters. The quality of the dentist is what matters. And the brands you're working with is what matters. You guys have all that. So it just makes a lot of sense.
I was really surprised. I was really, really surprised. And a little bit onto what you were saying right now is the brands, you got to be better. You got to be, or if not just as good. But it was just insane. Mm-hmm. It was just insane how, but everybody that was there from Florida was driving amazing vehicles.
That is a very Florida thing.
So was that a rent thing or is that a car thing or what was going on?
Probably a bit of both. Yeah.
And what I've noticed, and it was pretty crazy, is most of them were older dentists.
Yeah.
Okay. I didn't see many young dentists because to be able to own your clinic or to be able to be at these places, I mean, you had to be older, right? So,
right.
But they had the youngest receptionists and it was creeping me out, man. Cause I was just like, and I was like, I don't know. And then they'd get real close to the ear and they'd be like, talking to him. And I'm like, oh no, man.
What's going on?
I don't know, man. But,
yeah.
Well, very, very happy to have you here today. We really like to partnership with places like this that we really do feel and we know that you focus on patients. Just being able to work with you already implement things that I've never seen implemented on a company before.
Thanks. Yeah.
Like the pictures sent to you. There's other companies that didn't even care.
Yeah. Yeah.
And we would be asking for the pictures. And then you literally go through like a screening before it gets to Luis.
Yeah, of course. Yeah.
And other places just throw you leads.
Right.
And you're like, oh, here you go. The patient never answered. Well, they answered me or they called us or whatever.
Yeah.
You're like, whoa, it's so you actually care.
Yeah.
And you talk to the patient and you listen to their needs. And then you say, hey, you know what? These places are the right fit for you.
Yeah. Yeah.
And we're happy to be one of those fits for them for sure.
Totally. No, you guys are an amazing partner. Thanks for working with us. I think we're just getting started. There's so much cool things we can do together. And I think the vision you guys have for how you've built up this clinic as a place to help folks get amazing care at a great price, it's so impressive and looking forward to the next steps on the journey.
No problem. Is there anything else you want to say before we leave?
No, just love what you guys do. And for any patients out there, if you want to follow us, we're Usko Dental. So it's USKO and .dental. You can find us on Instagram as well, posting a lot from my experience here in Mexico. So check it out. You can see what it's like in Yuma, crossing the border, all of these steps that we talked about. It's super, super smooth. And yeah, thank you for making me feel so welcome here and really letting me experience what a patient experience is and see why people love this and come back and refer their friends.
And I'm going to tell you, like, off the bat, I'm really impressed with you were here. You, the CEO, you were here. You weren't hiding in Thailand. You're here in person. And you were actually video chatting patients while you were in our reception.
Yeah.
Hey, give me 1 second. I'm going to video chat some patients to let them know I'm here and show them. You would walk in the lab.
Yeah.
And you would be showing our patients or showing patients from Usko, hopefully future Supreme patients.
Yeah.
about everything. So you could have just been that CEO that'd be like, hey, I'm going to record this video and I'll just send it massively.
Yeah.
You were taking the time to be able to do this with patients. So that just speaks volumes. And obviously with you caring for patients so much comes the referrals.
Yeah.
Comes the trust, comes the Usko.
Yeah, exactly. I like it.
So so amazing. So thank you for being here, and obviously
you.
looking forward for this is just the beginning.
Awesome.
This is just
I
the
agree.
beginning. And thank you for being here at Supreme Dental Podcast, powered by Supreme Dental. And just like Usko, keep on smiling.
Love it. Thank you.
And if you don't know, now you know.
That's right. So.
And if you don't know, now you know.